Hello, everyone. I'm Loanne Lake, and I'm your host for the inaugural episode of Mental Wellness Matters, a podcast powered by Caring. We're live in Charlotte, North Carolina at Friendship Missionary Baptist Church for Caring's second annual Maternal Health Conference in recognition of National Maternal Health Month and as a way of educating the Mecklenburg County community about the work being done to address maternal morbidity rates in our state, in our county, and in our city. With me today is our guest and one of today's speakers, Mr. Kelly Little, who is a doula and a representative and advocate in the maternal health space. So help me to welcome Mr. Kelly Little, who's going to tell us a little bit about the work he's doing, his organization, and why maternal health is so important to him. Kelly, welcome.
First and foremost, thank you for having me. It is an honor to be here. Kelly Little, founder, CEO of the Urban Institute for Strengthening Families, an organization committed to creating paternal training for men and fathers. But more importantly, over the last couple years, I have chosen to walk down the path where I went through a doula process so that I can better help men support, serve, and impact the maternal health numbers and infant morbidity that's going on in Charlotte, North Carolina, so that we normalize wellness, physical support, non-medical support, emotional support, so that women birthing outcomes shift and change through a process that we call DICE. DICE being dynamic, innovative childbirth experiences. And the reason why I chose this is because several things. One, too many issues and challenges were happening in our city and across the country, and realistically, even outside the United States, as it relates to maternal health and in particular, Black maternal health. So either we are going to be a part of the problem or we're going to be a part of the solution. And I chose to position my organization to be a part of the solution so that we can mobilize men to be able to be support either for their significant other, their co-parent, or their daughters, cousins, nieces, and family members, because it takes a village to shift and change issues like the maternal health crisis.
Thank you for your work. Thank you for your passion. Thank you for your commitment. I know you presented today during one of the earlier breakouts. Can you share what your topic was and some of the takeaways from your presentation today?
So the topic was daddy doulas, the Father's Haven and daddy doulas. And many of the conversations around the research and data and the evidence-based information, particularly around the fact that 84 to 85% of some of the maternal health issues are preventable. And the action steps are, one, not only do we need to be present as men and fathers, but we have to be active. So we have to be present with presence, helping them to understand situations, particularly when they're under duress, supporting their mental health and wellness. And that really occurs well before the birthing process. We have to normalize that. And we know our significant others, we know our family members, and in doing so, we can tell when something is shifted, and we provide that support, we provide that encouragement, and also we make sure that those women and family members have access to information tied to research data so that they can make informed decisions that will optimize their health and the birthing processes, hopefully significantly shifting the number of birth challenges that they experience.
It's not often you see a male in a woman-dominated issue like this so at the forefront. How has your work been received both by the males and the females affected by these issues?
So it's definitely been embraced and welcome. Every space I've been in pretty much for my entire career has been a women-dominated space, particularly social services, human services. However, the reception that I received in this space have been unparalleled. One, because women know that men want to be involved. It's just a matter of putting the right person at the table to help activate their interests in specific challenges, issues, and better familiarizing themselves with how to even hold space for women. And so it's fairly easy for me just because I grew up in a house with predominantly women. So those skills are skills that have already been taught. But one of the things that I've noticed is that aesthetically, when you go in certain spaces, to your point, there is no pictures of men with their children. There are no books with men or for men. And so sometimes it seems as if health professional or health organizations may not be considering, like, you know what, maybe we need to put this in place aesthetically. Maybe we need to strategically and tactically make sure that we prioritize how we can engage men differently.
Yes.
And we should assume that every man wants to be involved. And when they're not, really do some deep dive analysis to find out why, so that we can shift what I feel should be normal for men to be involved and at the table with women, so that we can reduce those maternal health issues.
You make such a very good point. And it reminds me of an analogy in the real estate space where when there's a new development coming and they've got those banners around the fencing. And I remember working in another time in my career where we used to advocate for diversity in those futuristic renderings of a community, because when people don't see themselves in that future establishment, they think it's not for me, so I have no place here. It's the same with maternal health, and you're absolutely correct. There is a process of raising awareness, or sometimes it's not even that people want to be biased, but it's just, it's not in their consciousness.
Right.
Because the primary voices up until now may have been primarily women-based. So I remember our speaker in the last session, Mr. Charles Johnson, said his organization, For Cure for Moms, is working on a curriculum to help educate the father figures, the men in these women's lives or these mothers' lives. What do you have to say to men, partners, people who may not see themselves represented, but they silently want to be more involved? What is something you would share with them to encourage them to be more active and to be more of a champion for the birthing partner that they're with?
So what I would say is that most of the men I've talked to through my career want to be involved. They just haven't been invited to the conversation. And so when you sit down and you hold space with men and you share that, one, the 84% of maternal health issues and how it can be prevented just by their presence.
Wow.
In addition to that, we know that C-sections go down significantly when men are involved. And
Is that right?
Yes. And just being able to help women to be calm because they're going through physical pain and they know their significant other, their wife, pretty much better than anybody else. And so it's just really having that conversation and that dialogue of how we change and transform generations just through our presence. And as you start to go down that path and having that conversation, they begin to share how much they want to be a factor, not only for their wife, but for their children's children. So we are creating generational blessings just by having a dialogue and a conversation, and then sharing what the research and evidence-based material says about what happens when men are involved, and the fact that when we do skin to skin with our children, it has the same, if not a better impact than when mom has skin to skin with the child.
Wow. Well, I learned something new today, and you raised a very good point that it's important to invite them into the conversation at the bedside, in the birthing process, and after the child is here. So, Kelly, I want to thank you for your time. I wish you well in the work that you're doing. And how can people learn more about your organization?
So one of the ways they can learn more about the organization is, one, we have a podcast. It's called the Father's Haven Podcast. Two, www.ui, the number 4, S as in Sam, F as in Frank.org. Go to the website. The information is there. There are multiple curriculums out that discuss how we conduct workshops, teach emotional intelligence, all things that help prepare the father to be a significant vehicle in terms of being a model for their children, but more importantly, how they co-parent together with the mom and how they build a relation so that not only we support mom, but in doing so, that model helps any person that's connected to that family understand the importance of a father and a man in terms of helping to reduce maternal health issues, infant morbidity issues, and really transforming the lens of how we consciously think of maternal health, because it's not a mom or dad thing, it's a family thing.
And that's a great place to end. I'm just going to ask you one more time if you can repeat the name of your podcast.
Yes.
Say it one more time.
Father's Haven.
Father's Haven, and that's available on any platform where you can find your favorite podcast. Thank you, Kelly, and do have a great rest of the day.
You as well. Thank you.